Colon cancer is a silent threat. Detecting it early is very crucial for successful treatment and improved outcomes. In this video, I'll be sharing with you the factors that increase your risk of colon cancer, the major symptoms that should not be overlooked, and what you can start doing from today to reduce your risk of having colon cancer. Colorectal cancer is one of the leading causes of cancer deaths in men and women. It normally develops from abnormal growth called polyps in the colon or the rectum. Over time, these polyps can turn cancerous and cause various symptoms. Colon cancer is often discovered through routine screening tests such as colonoscopy. It can also be detected during emergency situations like intestinal obstructions, perforations, or bleeding. So what will make you to be at risk of developing colon cancer? Number one is age. As a person gets older, changes in the colon can show growth of extra cells and early signs of possible cancer. But over the last few decades, the incidence of colon cancer has continued to rise for people in the 30 to the 50 age bracket. A second risk factor is a history of inflammatory bowel disease. These are diseases that cause inflammation and ulcers in any part of the digestive tract. If you have a family member who has had colorectal cancer or polyps, it puts you at risk. Certain lifestyle choices like your diet, alcohol consumption, and tobacco use puts you at risk. Now let's dive into the symptoms. You need to know that the location of the tumor significantly impacts on the type of symptoms you will experience. If you experience these signs, it usually indicates that the cancer is fairly advanced. The most common symptom is a change in bowel habits, which can include diarrhea, constipation, or changes in stool consistency. This symptom is more common if the tumor is on the left side of the colon. The second warning sign is the passage of fresh blood in or with your stool. You could also have dark and sticky stool due to partially digested blood. Abdominal pain is number 3 warning sign, which can occur with the tumors anywhere in the colon. If the tumor is in the rectum, it will cause rectal pain with the passage of thinner and narrower stools shaped like pencils because a tumor is blocking the passage of stool. In the case of rectal cancer, you have a sensation of incomplete evacuation. You have this continuous urge to move your bowels even when the bowels are empty. The fourth warning sign is unexplained iron deficiency anemia, particularly common with right-sided colorectal cancer. This results from blood loss in the stool that is not physically detectable, and eventually part of the complications of this is persistent fatigue in the individual. Number 5 is a lump you can feel in your belly. Unexplained weight loss is another sign to watch out for, especially if you are over 40 and you are also having rectal bleeding and abdominal pain. The good news is that there are many things you can start doing to lower your risk of colon cancer even if you have a genetic predisposition. The first tip is taking an NAD precursor together with vitamin D if you are over 50. Researchers discovered that with a continuous 3 months administration of an NAD precursor, it reversed colon aging and cleared precancerous lesions completely. Number 2, avoid colon cancer promoting foods. For example, excessive consumption of highly processed foods, also foods that are high in nitrates and nitrites. Avoid tobacco, alcohol, high fructose corn syrup, and trans fats that can cause lots of inflammation in your stomach and the intestine. One of the best things you can do for your colon is to include lots of soluble and insoluble fibers in your diet. Examples include beans, sweet potatoes, garden egg, breadfruit, green leafy vegetables. Others are cucumber, brown rice, broccoli, citrus fruits, nuts, and seeds. Insoluble fibers work like a scrub inside your colon. They help remove old and dead cells, which are the ones that can turn into precancerous cells. Another great strategy to help reduce the risk of colon cancer is doing intermittent fasting or periodic prolonged fasting. Fasting is one of the best things to help stimulate stem cells in the colon to help heal the lining of the intestines. Intermittent fasting is something you should also consider to help manage diabetes. Check out the video right here. Please remember to hit the subscribe button right below the title of this video. Thank you for watching.